Good morning, everyone, and welcome to the OLLI Medical Series. Today, we will be talking about issues with thyroid function in the mature population. Thyroid hormone is a time-keeping hormone in the body that contributes to your metabolism, energy levels, heart rate and function, weight, appetite, muscle strength, hair quality and strength, and frequency of bowel movements. Did you know that more than 12% of the US population will develop a thyroid condition during their lifetime? This morning, we will discuss where and what the thyroid is, what thyroid hormone does, what problems high or low thyroid hormone levels might cause, complications of untreated thyroid anomalies, and how and when to get tested. Presenting today is Dr. Michael Ko. He is an endocrinologist specialist in Fullerton, California. He completed medical school at Albert Einstein Medical School in Bronx, New York, and an internal medicine internship and residency at Harbor UCLA Medical Center in Torrance, before finishing his endocrinology fellowship at Sinai Medical Center in Beverly Hills. Dr. Ko's area of expertise include treatment of endocrinological conditions such as diabetes, obesity, osteoporosis, and disorders of the thyroid, parathyroid, adrenals, and pituitary. Dr. Ko, please take it away.
Thank you for that introduction. I'll get this started here. Thank you for the invitation to speak at this forum. I hope that we'll have a good overview and an engaging conversation with a Q&A. So again, please feel free to chime in if you have any questions. I'd be happy to answer any of them. Just to echo that introduction, about 1 person out of every 8 in the US population will develop a thyroid function condition during their lifetime. And 1 out of 2 will actually have an abnormal growth in the thyroid. So today we will be going over an overview of the thyroid and thyroid function, an overview of thyroid hypofunction, thyroid hyperfunction, and go over complications of thyroid abnormalities, and take some time to go over an entity called thyroid nodules. We'll go over how and when to get tested as well. To go over some definitions, first, the thyroid is a butterfly-shaped gland that sits at the base of the neck. So this gland here is an organ at the base of the neck that looks kind of like this in this sort of beautiful rendition of a drawing. And it's split up into 2 lobes. So there's the right lobe, and it's connected by a little bit of tissue that we call the isthmus, and it has a left lobe as well. In men who have Adam's apple, it's very obvious where that cutoff would be, but the thyroid sits right below the Adam's apple, right here, and right above the sternum and collarbone. The thyroid gland is a gland that produces a hormone that circulates through the bloodstream. That hormone is abbreviated as T4, and in the tissue of the body, it's activated into an active form called T3. The thyroid hormone is probably best described as a timekeeper of the body. It regulates, amongst other things in the body, your energy levels. If you feel like you're tired or having too much energy, for example, it could be related to the thyroid. It also helps regulate, amongst other things in the body, your weight, your mood, your sleep, your heart rate, and your intestinal motility. Either having diarrhea or constipation could be related to abnormalities in the thyroid. And sometimes it can affect the regularity of menstruation and also bone turnover. As we move forward, we will talk about how having too much thyroid hormone or too little thyroid hormone will affect each of these things. So in thyroid hypofunction, you might imagine everything is slowed down. Time is kind of slowed down. So patients with thyroid hypofunction will have low energy. They'll start to gain weight. They may have low motivation throughout the day. And it might actually even affect their mood, causing depression, sleepiness, and it could slow down the gastrointestinal tract as well, causing constipation. And oftentimes, with everything slowed down, the body's ability to regulate its temperature will be decreased, and patients may end up feeling quite cold. This can lead to a slow heart rate as well. On the flip side, thyroid hyperfunction, everything is sort of revved up, everything is sped up. So patients with hyperfunctioning thyroids will experience very high energy levels, actually. And that could lead to some weight loss. And the energy levels can be so high that they actually feel anxious or even irritable. And having so much energy can actually lead to insomnia or trouble sleeping. Since everything is sped up, the body's temperature is also raised as well. So oftentimes patients with hyperfunctioning thyroids will feel very hot. And it could also cause the heart rate to go very rapid and even potentially even cause heart arrhythmias. The intestinal tract will be revved up as well. And so this could also contribute to diarrhea. How does the body regulate the thyroid hormone? How does it know how much thyroid it needs? Well, in the brain is able to sense how much thyroid hormone is in the bloodstream. And in particular, there's a little gland called the pituitary that sits right in the center of the brain that is sort of considered like the master gland. It helps sense other hormones in the body, including the thyroid. But there is a feedback cycle here where the brain sees how much thyroid hormone is being produced by the thyroid gland. And depending on how much it's seeing, it will send a signal called thyroid stimulating hormone back to the thyroid to produce thyroid hormone. So there's this sort of cycle here that helps regulate the levels of thyroid hormone in the body to normal levels. Sometimes if there's damage to the thyroid gland or damage to the pituitary gland, you can get hormonal issues. And to talk about a little bit more about those hormonal issues, we'll talk about complications of having very high or very low thyroid hormone levels. So thyroid hypofunction is abbreviated in a doctor word called hypothyroidism. So hypo is a prefix for low, and thyroidism kind of indicating that the thyroid hormone levels are low. Some complications of hypothyroidism can be having an enlarged thyroid. We have a doctor word for it, enlarged thyroid, called goiter. And so here in this picture, you can see an outline of that butterfly-shaped gland that we showed you earlier in the presentation. So this is an enlarged thyroid. Having low thyroid levels, because it slows down the system, can lead to heart problems. As we talked about some of the mood issues, it can lead to mental health issues, causing severe depression. Sometimes some of the regulatory processes in the body can be affected by sort of everything slowing down, and sometimes patients can get nerve issues. They can also develop swelling of the legs. And if it affects menstruation, it can lead to infertility. And if not caught while during pregnancy, it can also lead to some birth defects. Hyperthyroidism, we went over some of the possible symptoms, but if not treated, that fast heart rate can lead to arrhythmias such as atrial fibrillation or supraventricular tachycardia, where the heart races so fast that you may have to go to the hospital to get it corrected. It could also be a lot of stress on the heart to the point that it fails and makes the heart unable to pump forward as effectively as before. That increased timekeeping can also release a lot of calcium from the bones and lead to brittle bones or osteoporosis. Sometimes one of the causes of hyperthyroidism can also lead to some proteins that attack the back of the eye and cause bulging eyes, like in this picture here, and lead to some eye issues where you can't, you have double vision, or you can't move the eyes as effectively as before. And it can sometimes even lead to muscle weakness. And this is sort of a condition that can happen that we sort of call, with a doctor word, called thyrotoxicosis, meaning the thyroid levels are so high that it's toxic to the body. And if it becomes very serious, it can become a medical condition called thyroid storm, where you could get extremely sick and need to go to the intensive care unit. This condition can also cause some liver damage as well. Now, how do we treat these two conditions? Well, with low thyroid issues, the treatment is to give thyroid hormone. There's two types of thyroid hormone, levothyroxine. This is a form of T4, which is the majority of thyroid hormone in the body. And then there's the activated form of thyroid hormone, or T3, and that has been synthesized in a drug called liothyronine. This medication is taken once per day, typically, and needs to be taken on an empty stomach, waiting at least 30 to 60 minutes before eating anything, because this particular hormone is very sensitive to malabsorption if you take it with a meal. It's also a hormone that's very sensitive to other medications, such as calcium or iron, which can also bind with this hormone and make it difficult to absorb. The treatment for high thyroid levels, or hyperthyroidism, there's a few number of things that can be done. There is a medication called methimazole, or PTU. These are thyroid blocking agents, or thionamides is what the class of the medications are called. And these medications are typically taken once or twice a day, and they work by preventing the thyroid from producing thyroid hormone. Now, because the thyroid is overactive, the other ways to treat this condition is to destroy or remove the thyroid altogether. Iodine is a compound that goes into the thyroid and is actually converted into thyroid hormone. And so if we put a radioactive isotype of iodine, it will get concentrated into the thyroid and destroy only the thyroid tissue. So that's sometimes a treatment that we have to do if we aren't able to get it under control with these medications. And then the alternative is to have a surgeon, a thyroid surgeon, actually remove the entire thyroid. And that would be a treatment of hyperthyroidism. Now, if you don't have a thyroid from these two sort of definitive therapies, then you would need to have thyroid replacement therapy. And that takes us back to the hypothyroid treatment. So these two sort of definitive treatments of the thyroid would result in needing to take thyroid hormone for the rest of your life. Okay. So those are the issues of thyroid function that can happen in a person. I'm going to move on to issues with abnormal growths in the thyroid tissue. So again, surprisingly, this is a common issue. About 50% of the people, if we were to take an ultrasound and take a look at people's thyroid glands, 50% of people will actually have abnormal tissue in the thyroid. We doctors, we have sort of a word for this, for abnormal tissue. There's actually several doctor words for abnormal tissue. There's nodule. There's also other synonyms like node, lesion, mass, tumor, or adenoma. They all mean the same thing. They mean that there's abnormal tissue. Now, what do doctors always worry about with abnormal tissue? We're always worried about cancer. If there's an abnormal growth somewhere, we always want to make sure it's not a cancer or something that's going to spread through the bloodstream or the lymph nodes and spread to other parts of the body. It happens out 95% of the chance these nodules are what are called benign or not cancerous. They might grow, they might shrink, they might stay the same size or even disappear over time, but they're not a cancer. They're not going to spread to other parts of the body like the brain, the other parts of the neck, the lungs, or the bone. But as a physician, doctors as a community, we want to find the 5% so that we can give the people with cancer treatment. Interestingly enough, thyroid cancer is actually one of the best cancers to get because relatively to other cancers, most people die of something else, not from the thyroid cancer itself. Thyroid cancer is generally slow growing. There are rare forms of thyroid cancer that are more aggressive, but for the most part, the treatment is extremely effective. So as a community, we look forward to sort of finding these nodules and kind of finding thyroid cancer so that we can give treatment because it's highly successful. Now, in order to find out the 5% of people with thyroid cancer, what we do is, the best situation is to remove the entire thyroid and give it to the pathologist, and they would tell us if it's a cancer or not. But because only 5% of these patients have cancer, we would be removing too many thyroids. So in fact, what we do is one step before that, we actually do a biopsy, which I will show you a little bit later. But first, let's go over what kind of complications that an abnormal growth in the thyroid could cause. So in the previous picture, the thyroid sits very closely to the windpipe, the food pipe, and also nerves that control the vocal cords. So if a nodule grows big enough to push and squeeze on the food pipe, it can actually lead to difficulty swallowing. If it pushes on the windpipe, you'll actually have difficulty breathing if you lie down. When you lie down, the head kind of lies in a certain way where pressure on the front of the base of the neck is a little bit more than before and can push on that windpipe. And then there's two vocal cord nerves that run right behind the thyroid. So if anything inside the thyroid has an abnormal growth that grows far enough back, it can push on that nerve and actually cause some hoarseness of the voice or even a change in pitch or tone of the voice. And then lastly, what I sort of went into is that sometimes these nodules can be actually a cancer. So a biopsy, also, in a doctor word, we kind of call it a fine needle aspiration. We take a syringe with a needle, and the syringe, the needle is sort of the same size as what you would get in any blood draw. And we actually take that needle and put it inside the thyroid nodule to try and get some cells to give to the pathologist to tell us how it goes. We do it under ultrasound guidance like this. And the whole procedure takes about 10 minutes. And usually the skin is numbed beforehand, and we take multiple passes, about a range between 4 to 6 passes of the nodule in order to get enough cells for the pathologist to tell us. Okay. So when should you be worried about your thyroid, and when should you have your thyroid tested? Well, if you have any heart arrhythmias, energy issues, mood issues, weight issues, sleep issues, or you feel a little lump in the throat, these are all reasons why you might want to have your thyroid levels checked, and maybe even have your thyroid examined by a physician, and potentially having an ultrasound done of the thyroid. How to get tested? Well, any primary care doctor or general practitioner can have this arranged for you. Otherwise, you can see the specialist of the thyroid, the endocrinologist, who can also help with checking your thyroid levels and also having your thyroid examined, or even an ultrasound done to check for nodules. Okay, and at this time, I'll open it up for a Q&A session. Here, while we talk, I left some resources for motivated audience members who want to read a little bit more on their own. The American Thyroid Association creates the guidelines for endocrinologists and primary care doctors on what to do about thyroid function and also thyroid nodules. This is a free textbook that has quite a lot of great information called thyroidmanager.org. And also this website, hormonesdemystified.com, is a blog managed by a very reputable endocrinologist in Boston who answers many frequently asked questions by patients.
Okay, if you have any questions, you could either type it into the chat room and I'll read that off, or you could raise your Zoom hand and I'll allow you to ask your questions. Yes, Barbara?
Yeah, my question is how, if you're already taking thyroid medication for hypothyroid, how often should you be rechecked?
Well, it depends. Usually it takes about 3 to 4 months to find out what the right dose of thyroid hormone is. And then once it becomes stable, we check maybe once or twice a year.
So you should initiate it, or should your doctor initiate it, or what?
If you're on thyroid hormone, likely your doctor is checking your thyroid levels on your annual physical labs. So it should be about once a year.
Okay, thank you.
Okay, Susan?
Yes, if you're on thyroid, excuse me, if you're on thyroid levels, thyroid hormones, and you take one in the morning, and then you said it interferes with certain other medications and food. So how long after you take it first thing in the morning can you have coffee or your breakfast?
It's recommended to wait about 30 to 60 minutes. 60 minutes is better, but 30 minutes is fine. And so what's recommended, what my other patients, they like to do is they keep their thyroid hormone on their nightstand with a little bit of a bottle of water or a cup of water. And so the first thing they do when they wake up is they take the thyroid hormone, they take that sip of water, and then they either hit the snooze button or they get up to shower or brush their teeth. And by then already about 30 to 45 minutes have passed, and then they can have their breakfast.
Okay, now then if you have to take a second dosage later in the afternoon, do they have to be spaced, like 4 hours between the first dosage in the morning and the second dosage in the afternoon? Does the space have to be like, does it have to be 4 hours, or can it be a longer time or a shorter time?
Right. The second dose of thyroid hormone, I'm guessing you're on Cytomel or liothyronine.
Well, I have levothyroxine in the morning with leothyroxine, And then I just was added a Leo-Thyroid to take at lunchtime, like just before lunch. But sometimes I don't have lunch at exactly, the time, like it could be like 6 hours after breakfast or 4 hours after breakfast.
Right. So that second dose is particularly to try and target some afternoon fatigue. It's true the absorption won't be quite as good, but basically the timing of the second dose should be where that dip of energy happens in particular. So there's no specific recommendation about 4 to 6 hours from food or anything like that for that second dose, because it's being used to target a certain symptom usually.
So so when you take your second dosage of the Leo-Thyroid, do you also have to wait like 30 minutes before you have lunch?
Not for that second dose, no.
Oh, okay.
Yeah,
All
that
right.
second dose, we kind of accept that there's going to be malabsorption because if you had breakfast or lunch, so we just kind of accept that, and then so you can just go ahead and take it.
Okay, thank you very much. I appreciate it.
No problem.
Okay, a question from the chat. How do you get tested to determine your thyroid levels?
It's a simple blood test. So basically, the doctor will give you some lab orders to do. You take it to a local laboratory, and it should be back within 1 or 2 days.
Okay. Kiki?
Thank you. Mike, I have 2 questions. The first is there a difference between Synthroid and the generic in patients?
So the medications are identical. Now, some of the inactive ingredients might be different from a generic company versus Synthroid. There's also several generic factories and companies. So from generic to generic, there may be differences amongst them. Synthroid in particular has a little bit more regulation on it and a little bit more quality control. So what we find is from pill to pill, the amount of thyroid hormone is a little bit more close to each other than sometimes what we find in the generic pill. Some of the generics are made from other countries and don't have as strict regulation. And so sometimes there can be a little bit more variability with the generics, but essentially, yes, they're considered the same. There are some advantages to Synthroid. Synthroid is also a bit more expensive, unfortunately, because of that quality control.
Sure, I understand that. I take Synthroid. I've been taking it for 27 years. I just find that the insurance companies seem to want to always push the generic. And I just find that very difficult when, I take Synthroid, but I always get pushback. So that's why I asked the question.
Oftentimes I will prescribe Synthroid and then the pharmacy will just change it on the doctor. So it's frustrating all around because it's not sometimes it's not even intended.
Yes. And then my second question is, you said 30 to 60 minutes, which I understand. My question is grapefruit. Can you have grapefruit after 60 minutes safely?
Grapefruit is one of those fruits. It's delicious, but unfortunately, it creates a lot of problems for a lot of other drugs because it activates some of the proteins in the liver, and can cause some medications to go higher in level. In terms of the thyroid, totally okay, but grapefruit has some issues if you're on a cholesterol medication, for example, and some blood pressure medications, it can cause as well.
Sure. No, I just take Synthroid. That's the only medication that I take. But I just wanted clarification on that. And then one last question. After a period of time, does taking a thyroid medicine like Synthroid, can it cause heart problems like murmurs later in life?
It can if you're being overtreated. But if the treatment on this medication, you've been kept at normal levels, it should not cause any complications or problems later in life. Now, certain situations happen where patients are overtreated with thyroid hormone, and yes, that can cause increased bone loss. It can cause heart arrhythmias, heart failure, if that's being done for a very long period of time.
Okay. How do you know if you are overdosed, I guess?
It's based off of the labs, and luckily you have to be overdosed for a very long period of time. The other signs of maybe you're being overdosed is if you have sort of tremors, shakes of the hands, feel like your heart's racing at times, feel like maybe you have too much energy, feeling anxious or irritable, trouble sleeping, diarrhea, kind of symptoms of having too much thyroid hormone. Sometimes it can be sort of subtle though. And so sometimes the only way to catch it is if your thyroid labs are off.
Okay, so if your labs have never been off, let's say in the 27 years I've had, we're good to go.
Exactly.
Perfect. Thank you so much, Dr. Koh.
No problem. Thank you for your questions.
Okay, can you discuss the parathyroid glands? What do they control and how do they interact with the thyroid?
Sure, absolutely. So the parathyroid doesn't actually interact with the thyroid at all, but para is a word for close to or nearby. And so the parathyroids are actually 4 glands that sit right next to the thyroid. The parathyroid gland produces a hormone called parathyroid hormone, and it works on the bone to release calcium in the blood. So your blood needs a certain amount of calcium for all of the nerves in your body to work appropriately. So for your heart to function correctly, your intestinal tract to function correctly, your brain, everything relies on making sure your calcium levels are at a reasonable level. Now, if you have a parathyroid gland that is overproducing parathyroid hormone, that can make you release a lot of calcium into the bloodstream. Because it's pulling that calcium from your bones, you can develop osteoporosis or weak bones, where you can get fractures more easily in situations that you really ought not to get fractures. And because of that high calcium levels in the blood, they get filtered through the kidneys. So sometimes they can develop kidney stones, and those kidney stones can cause damage to the kidneys. And calcium levels, because it's out of the normal range, can sometimes cause issues with your nerves. So sometimes it can cause constipation. Sometimes it can cause a decreased appetite, abdominal pain. Sometimes it can cause some brain fog or confusion as well if it gets very severe, and sometimes some heart issues if the calcium gets very, very high. I hope that answered the question.
Okay. Jody, would you like to ask your question?
Yes. Well, now I have 2 because I had the original one and then your grapefruit prompted another one. So, but the first one, I've been told I have heterogeneous thyroid where it's just lumpy and bumpy by nature. So they kept trying to do needle biopsies. And one time it'd be low and one time it'd be high on the same nodule. What are the odds of having that kind of a thyroid developing into anything else? Because I had quite a few side effects from the needle biopsy.
Did the biopsy come back as benign?
They do come back as benign, although some are questionable because they increase and decrease, and some apparently are difficult to access, which mine didn't take 10 minutes. It was an hour and a half. So that tells you right there.
So it sounds like it was a really tough biopsy and you had complications. So that's a difficult situation. Sometimes you run into people for whatever reason genetically, they just are prone to developing a lot of nodules. It sounds like there's some questions and some benign nodules in your situation. You know, benign nodules, they're not cancerous. You know, once you have a biopsy that tells you it's benign, it's very unlikely that it's a cancer. You know, not every test is perfect. So what we say is there's less than 1% chance it still could be a cancer, even though you had the biopsy. So it's very unlikely. Now, benign nodules, they can grow, they can shrink, they can stay the same size, they can even disappear. And so in your situation, the main thing is to watch out for problems of nodules that are growing too big. And so if you develop issues with swallowing, breathing, hoarseness or change in pitch of your voice, any pain in that thyroid area where it's sitting, or cosmetically, if it's sort of growing so big that you don't like the way it looks, those would be reasons why you might need a surgery to remove a benign nodule. Now, in general, we like to avoid surgeries because there's complications with that too. So if you're not having any of those 5 symptoms, then just kind of keeping an eye on it and watching it is totally fine.
Okay, well, that's kind of what we kind of gave up on the biopsies because I just had odd reactions with I don't know. I have something with the needles in the neck. I don't know. But,
Right. It's a sensitive area, unfortunately.
One time I got an instant migraine. I mean, instantly. And the second time, instant nausea. And I didn't have either of those going into the appointment. So
right.
It hit something in me that I must be very hypersensitive or something, that it hits those areas and I get those reactions. So we both the doctor and I gave up on the.
I'm sure it's not a complete give up because you're probably still getting ultrasounds.
Good idea. Let's not do this. I vote for not doing this anymore.
Yeah, and interesting enough, like after following a nodule for years, again, underneath all this, what we doctors are worried about is cancer. We want to treat cancer, but oftentimes the nodules are benign, and we follow these nodules over the years, kind of doing an ultrasound every 1 to 2 years, and then kind of slowing down. And if there aren't any changes after 10 years, we kind of breathe a sigh of relief, because it's really unlikely that, if there was a cancer, it probably would have spread by then. And so after 10 years, we kind of say, okay, breathe a sigh of relief. We can slow down and kind of, and eventually some people, when their nodules never change or they shrink or they disappear, we tell them they don't need to be followed anymore down the line. But it really depends on how long you've been followed.
Well, I'm assuming too that I'm old enough that I'll die of something else first anyway, right?
Right. Yeah, it's a funny thing to say, but why fret about something that's not gonna be the problem in the end, right? So
okay,
you're right about that.
So then you mentioned about grapefruit, and I was in a pharmacy and I overheard a pharmacist telling somebody else about the grapefruit with simvastatin or some sort of a heart thing he was getting. And the pharmacist said, look, if you had a grapefruit once a week or twice a week, it's not going to have a long-term effect or an immediate effect on the medication you're taking. They're talking about pretty much higher doses of grapefruit. Is that correct?
Yeah, in particular, grapefruit juice is like 10 different grapefruits put into one kind of a drink, right? So that's going to have a much more potent effect. Once in a while, probably fine. When you ask the doctor, we're always very conservative. So we say, no grapefruit at all, like don't even risk it. But the pharmacist is probably right. Once in a blue moon, once a month, that kind of thing, very rare, probably going to be fine.
Well, he's not, we were talking about eating actual grapefruit, not the juice. So if you're eating an actual grapefruit, you're not getting all that much dose of grapefruit juice. It's not like drinking a whole glass out of one grapefruit. You don't get that much juice out of a grapefruit. So would it be okay for those people to have one grapefruit a week or 2 grapefruits a week?
It's probably fine. Less is better. I would say maybe once a month, and ideally not at all would be the safest thing to do.
Okay. All right. Thank you so much.
No problem.
Are there any non-medical treatments to proactively manage or thyroid issues?
Are you saying like if you have a thyroid condition and not in sort of treating it without medications?
Well, they ask proactively manage this issue. So I don't know if that's beforehand or if they have it already.
So I guess proactively manage it beforehand. There are certain things that can predispose you to having thyroid issues, like not getting enough iodine in your diet. This is one of the this is one of the things that luckily it was decided very on in American government to enrich many of the foods we have with iodine. So this is a problem we often seen outside of America, where they don't put iodine in sort of the the salt or bread that we eat, and so oftentimes that can lead to enlarged thyroids. We see that quite often outside of the States, but it's not quite an issue here. There are also things called goitrogens that can be found in food. You do have to take an excessive amount of these things, but things like Brussels sprouts, for example, can sometimes increase the chance of getting enlarged thyroids. So there are things that you can do by diet, but really, if you eat sort of a regular Western diet, you shouldn't run into any issues. You kind of have to go over and above eating these goitrogens to develop issues.
Person asks, why would their dose of their drugs be changed? They took 75 for years, and then it was changed to 88.
It depends on what's causing the thyroid issue, but one of the most common causes of hypothyroidism or low thyroid levels where you have to take thyroid hormone is something called Hashimoto's thyroiditis. This is an autoimmune condition where the body's immune system has gone confused and decided to attack the thyroid. Autoimmune conditions can come and go. And so sometimes they're quiet and then sometimes they come up and cause inflammation of the thyroid. So it could be that you're in an inflammatory phase and more of your thyroid has been destroyed, and that's why you need to take more. The other thing is that depending on your weight, if you gain weight or lose weight, you actually need more or less thyroid hormone levels. And so it really just depends on the situation. Also, sometimes certain medications are started that can cause a malabsorption of thyroid hormone that might need an increase. So if you take any calcium or iron 4 hours near the thyroid hormone, that can make it so that you're not absorbing as much thyroid hormone. Sometimes a really common medication, an acid-reducing medication, proton pump inhibitors like omeprazole, Nexium, pantoprazole, these medications reduce the stomach acid in the stomach and sometimes can make it so that you don't absorb as much as the thyroid hormone anymore as well. So that could also be a reason why you might need more thyroid hormone.
Another question. So we shouldn't even have coffee in the morning when taking thyroid medication?
Technically, no. Technically, no. Now, do a lot of my patients do it anyways? That's yes. And so if it's very consistent every single day, then we would be able to change the thyroid dose to accommodate that coffee drinking. But if sometimes patients run into issues with their energy levels not feeling quite right because of that fluctuations. The thing about a malabsorption of thyroid hormone is that it's inconsistent. We say about 25 to 30% of the absorption is decreased, but from day to day, it can be a little bit more, a little bit less, and that can cause fluctuations that can sometimes make people feel unwell. So the cleanest situation is to take it on an empty stomach in the morning and waiting that full 30 to 60 minutes. So that way it's completely absorbed. And then that way you get very consistent levels in the bloodstream.
Okay. Same question for iron supplements. Should they not take them in the morning?
If you're taking thyroid hormone, the iron supplement should be taken anytime after lunch. That's about 4 hours away from when you might be taking the thyroid hormone.
Okay. Can thyroid issues lead to parathyroid issues or the reverse?
Sometimes, so parathyroid issues do not lead to thyroid issues. Sometimes hyperthyroidism can lead to high calciums in the blood, but that would not cause a parathyroid issue. So there's a little bit of overlap, but they don't lead to one or the other issue.
Okay, Barbara, would you like to ask your question?
I have another. Yeah. What if you take your morning thyroid medication with orange juice instead of water?
It's preferred to be done with water. With orange juice, there may be a little bit of malabsorption.
Okay, thank you.
Why would your T4 level change after being stable for 10 years on the same dose? The exam was negative.
It depends on the situation. Again, it could be some inflammation or more damage to the thyroid. It could be related to weight changes. It could be related to medications that are also being taken. It could be related to how the medication is taken. There's also another issue is there is a supplement called biotin, which is often found in B complex vitamins and also found in hair or nail supplements. And biotin doesn't affect the thyroid levels in anybody's body, but biotin is actually something that's used inside the lab test. And so if you're taking those supplements like a B complex vitamin or a hair or nail supplement, that can lead to abnormal labs, but not necessarily reflective of what's going on in your body. So in general, we just say to hold anything with biotin for 5 to 7 days before your lab test, and then that should help make sure that the labs are reflective of what's going on in your body.
Is it okay to take thyroid hormone before bed if you're sure not to eat food for several hours beforehand?
Yeah, we have certain situations where patients really have difficulty taking the medication in the morning. And so what's really more important in that situation is to make sure that it's being given daily. And so in certain situations, we do tell patients, hey, take this medication at bedtime. In general, patients who do this, we encourage them to try and eat their dinner around 5 to 6 p.m. because then at least about 4-ish hours have passed where their stomach has been empty and would give them the best chance of being in a fasting state. The reason why we say give it in the morning is because you for sure have had an empty stomach for about 6 to 8 hours. And in fact, there's certain situations where we have patients who really aren't able to take the thyroid hormone daily. Sometimes they have some mental health issues that are getting in their way of doing that. And for those patients, we actually tell them to take an entire week's dose of thyroid hormone all at once. And that's usually very rare where we have to do that. But in certain circumstances, we have to have these patients take it once a week like that.
Why does the medication cause hair thinning? And is there a way to prevent hair thinning?
The medication doesn't necessarily cause hair thinning. Sometimes it could be, the hair thinning could be related to maybe the thyroid levels being off a little bit. Now, there are inactive ingredients inside the thyroid medications that we don't necessarily know how they might affect the body. Sometimes in terms of the hair thinning, it could be related to other things. Hair thinning can happen with nutritional deficiencies, like not having enough vitamin D, for example, or zinc. And so hair quality can sometimes be related to age as well. So sometimes that's a bit more difficult to sort of suss out what's causing it.
Okay. Barbara, you have another question?
Yeah, I'm back. Which medication causes hair thinning? I thought the levothyroxine helps thicken up your hair.
That's only if having abnormal thyroid levels is causing hair thinning. So actually having thyroid levels that are very high or very low can decrease the quality of hair. And so if you have hypothyroidism or low thyroid levels, the medication can improve the hair if the problem is related to the thyroid.
Okay. Yeah. Thank you.
Since the parathyroid functions independently of the thyroid, can high calcium eventually also lead to thyroid problems?
No, the calcium regulation is completely separate from the thyroid. Now, sometimes hyperthyroidism, because everything is revved up, everything in the system is revved up, that can lead to calcium leaking out of the bone and lead to high calcium, but the high calcium itself will not affect the thyroid.
Are there any other questions? Okay, I don't see any other questions at this time. So I'd like to thank you, Dr. Ko, for coming and speaking to us.
Well, thank you for having me. It was very nice to have that stimulating exchange with everybody in this forum, and I hope this meeting was helpful for everyone.
Thank you very much.
Okay, thank you. And
Bill,
You very good.
Thank
Bill,
you.
You have a hand up, Bill, Paul DeLand.
yes, Paul.
I have a couple of questions. I was wondering if the doctor could say anything about the relationship between autoimmune diseases, especially Crohn's disease, and the thyroid, and can that cause an increase in nodules?
So autoimmune disease is one of those things where genetically you have a predisposition to them. And so what we generally say is if you have one autoimmune disease, it's likely to have a second and even a third one. Is there association between Crohn's disease and thyroid autoimmune disease in particular? Not necessarily, but just having an autoimmune condition will predispose you to other ones. So like celiac, rheumatoid arthritis, lupus, Crohn's disease, autoimmune thyroid disease, just by having one of those, there's a likelihood of having the other ones as well.
And is it related to nodules on the thyroid?
Patients with autoimmune thyroid disease, oftentimes because of that inflammation, there is a slightly increased risk of having nodules. Yes.
And one more question. My TSH has been running high and increasing while my T3 and T4 levels are at normal levels. And my doctor and I have kind of agreed to watch this for a while, but if my TSH continues to increase, will I need to go on medication?
You might have to, especially if your free T4 or T3 levels ever go low, then you definitely need to be on medication. If your TSH ever goes above 10, then you definitely need to be it. Alternatively, if you ever develop symptoms of, weight gain, like 10, 20 pounds, even though you're exercising and doing, dieting and everything like that, or feeling cold all the time, feeling like you have very low energy levels, or having really bad constipation, then those would be reasons to start thyroid hormone. Do you have autoimmune thyroid disease?
I do not.
Okay, then sort of watching it is totally fine.
Okay.
If you're not having any issues with it.
Thank you.
Okay, so a question about the dosage amounts in the pills. This person says that 0.1 is not quite enough and 0.112 is too much. Do the companies make other dosage levels? Right.
So the thyroid hormone levels has what we call a narrow therapeutic range. And so as an endocrinologist, a specialist, I do run into this situation quite often. Unfortunately, there isn't a dose between 100 and 112. The compromise here is to take an extra half tablet of 100 once a week. So that's 7.5 tablets in the week, or the opposite, take 6.5 tablets of 112. That's how you would get the in-between dose between 100 and 112. And the reason why that works is thyroid hormone, T4 in particular, has a very long half-life. It's 7 days. So because it lasts in the body for so long as your weekly dose is right, you will get the right thyroid levels in the end of the day.
Okay, Phyllis and Jim.
Yes, how does the thyroid cause bowel constipation?
So if you have low thyroid levels, it's sort of like the timekeeper is slowed down. So protein turnover is slowed down. Your nerves work a little bit slower. So when you have low thyroid levels, you're not getting enough of a sort of the oomph or energy in the gut, in the intestines. So things are slowed down. And because that slowing happens, that leads to constipation.
Okay, any questions again? Okay, well, thank you again, Dr. Ko, for coming and talking to us today.
Okay, no problem. I hope everybody has a great day.
Thank you.
Thank you.
Thank you. It was wonderful.
Thank you
Thank you.
very much. Yes.
Okay, thank you, everyone. And we will see you again next week on next Wednesday. And Carol, can you tell us what the topic is?
The topic is going to be stress in the times of COVID-19. And the speaker is going to be a PhD from UCI.
Okay, thank you. And we'll see you all next week.